This is our patient Kelly. She has had too much sun over the years and unfortunately was born as a Fitzpatrick type 1, which is a redhead. So every time she goes to the beach she gets a burn, never tans, and her melanocytes, in order to protect themselves, have clumped up and formed these freckles. And you can see her main damage here is in the cheek area, but she also has freckling on the upper lip. You can see her upper eyelid is not damaged that much. So our project is to rejuvenate her skin with our 5-step rejuvenation program. Our first step, of course, is to stay out of the sun and not smoke. Well, luckily Kelly never smoked, but now she's can't go in the sun. She wears an umbrella if she's going to go out, and doesn't plan to take up a life of tennis or fishing because her skin won't tolerate it. So she's already met step 1, which is free radical avoidance. Step 2, she uses her skincare program. She does her buffing grains from top to bottom twice a day, uses her alpha hydroxy toner to strip off the dead skin cells, and uses her vitamin A conditioning lotion to puff out new cells to get rid of any fine lines. So she's been using her skincare program. She's had glycolic microdermabrasions as her next step in the skincare program. And then today we're going to start her series of ProPeels. She'll probably need like 4 ProPeels by over the next year to peel off these freckles. So the first step of our 5-step rejuvenation program with the sun avoidance, she's doing that. The next step is her dedicated skincare program, and she's really pushing that. Then she had her microdermabrasions, and now we're doing the glycolics. Now, we're doing the ProPeels. She will not need the 5th step, which is a heavy resurfacing for like acne scars or heavy lines, or for like a lift. She doesn't need that. So she'll only have the 4 steps to avoid the sun, use her skincare every day, to do the microdermabrasions a couple times a year as a booster, and the ProPeels. So we're going to start today with our ProPeel 1, 2, 3, 4 up in the forehead area where the skin's thickest into the décolleté area, and then work back towards the middle where the skin's more sensitive. So if you look at our tray, we have ProPeel 1, which is our modified Yesner solution, ProPeel 2, which is a blend of alpha hydroxys and trichloroacetic acid, 7.5%, and then our ProPeel 3, another blend of alpha hydroxys, higher amount of salicylic acid combined with 15% trichloroacetic acid, or TCA. And then finally she gets the high dose retinoid peel with the vitamin A at the end to blend everything in and make sure the peeling's uniform. So we found this to be a real evolution, the progressive peel, to make everybody peel, but yet not be really deep and cause any scarring or side effects. Notice on our tray we have the eye irrigating solution, which is really handy, and if we happen to get anything in the eye, we can irrigate out any chemicals. However, I've never used it. It's just there for security. So make sure you have an eye irrigating solution. We also have water here, just to remind us that during this next day, she has to drink like 4 of these Crystal Springs spring water. Just drink some water, about 8 glasses during the first day. A lot of people come in for these ProPeels thinking it's some kind of surgery, and they haven't had enough fluid. They're almost what we call NPO, nothing by mouth. And when we use our peel, we want to have a lot of water, a lot of fluids in the bloodstream to flush everything out. So she'll have like 4 of these before bedtime, a lot of water. We have a mirror so she can see the frosting. We're going to try to get the foggy red blanch, what we call Dr. Obagi level 1 peel, and so she can examine that. We'll have our folded up 4x4 gauzes. Remember, that's the Dr. Obagi invention, to use an aggressive old 4x4 sponge. We use the old-fashioned ones that are woven cotton because they're abrasive, and we're going to be getting a little bit of chemical abrasion with our chemicals and a little physical abrasion with the 4x4, and then we'll do any little touch-ups with the Q-tip. So it's going to be an abrasive application of our peel, as opposed to the old-time dermatologist doing peels with just a little bit of a Q-tip, and all they got was the chemical peel, didn't have advantage of the abrasion. So we're always going to have a a dry sponge in the left hand and our active one in the right hand, or if you're left-handed, it can be the reverse, but you always have one dry one in case there's a little tearing. You can catch a tear, or if there's a run, you can catch the run. So this is our dry one. This is going to be the wet one, so we're going to use our ProPeel 1 solution, which is the modified Yesner, combined with natural moisturizers like urea and PCA. So it's a mixture of salicylic acid, lactic acid, and citric acid. We say modified because we've taken out the resorcinol. We use the resorcinol in the old ProPeel because it was a good peeler by itself. It doesn't work as well in combination with TCA. And also some people who have had a lot of resorcinol peels become allergic to resorcinol. So to avoid that, we use the modified Yesner, and we're going to pour some on. And this is going to be our sponge. We want to make sure it's not too wet and runs, so we squeeze it dry. And then we have our wet sponge and our dry sponge. We're going to start on the forehead. We always go into the hairline. We want to make sure that we don't have any skip areas. So we're going into the hairline, and we're going to be stripping off any dead skin cells. So you can see here we're starting to get some skin cells coming off, and our hope is to keep the skin perfectly clean. And notice that she's turned her fan on. She doesn't really have burning at this point, but sometimes the alcohol fumes will bother your nose. So she's going to just keep a little low fan going to blow off the alcohol fumes. And we're going to keep on going till we get all of the old dead skin cells off. So we're going to be doing our décolleté area. Want to make sure you get up into the hairline, go across the lower lobe of the ear, lift up your chin, and do the neck area. She doesn't need so much on the neck because she has no freckles here, but we don't want to blend it in. We want to make sure everything is uniform all the way from the décolleté area up into the hairline. So now we've got our first layer of our ProPeel 1 on, and we see we're taking off a lot of dead skin cells. So we're going to fold this over and get ourselves a little bit of fresh number 1 ProPeel, the modified Yesner. So we can keep on going. I say 3 coats of each level, but you'll see sometimes it's like 4 or 5 coats to get everything clean for each level. So again, we start on the forehead because that's the thickest and an area we can examine and see how we're doing. Come across here, onto the neck area, up into the hairline, across over here in the décolleté area. We're going to be working on this because she has these fine lines developing right through here from too much sun, and we're going to be pushing these out with our skincare program, the microdermabrasions, and also our little ProPeels here. She's getting a little bit red from the first step of the ProPeel, which is just showing us that she's been using her preconditioning program very good, and we're getting a little reaction because of her preconditioning. She has a very thin stratum corneum here because of her buffing grains and her toner with the alpha hydroxy acids. So notice we have quite a bit of redness here, where we're making a little note in our own mind that she's probably had enough of level 1 here because she's got a nice red reaction. But we also don't have that redness up on the whole face. So it's pretty red in the cheekbone area, which is an area that has had a lot of sun damage, and we'll take the peel pretty actively. Notice that this cheekbone is redder than this one. That's because I'm right-handed and don't end up with enough peel on the left. So I'm going to put an extra layer here on the left, and we get the nose area, which has a lot of sun damage also. Once we have a very dry sponge, we've been going over everything, then we can go right over the eyes because we have a dry sponge, and start to rejuvenate the lids also. The lid skin is the thinnest of the skins, so we do that at the end. And she may tell us she has a little eyelid burning, in which case we won't put so much on. So let's roll your lips in, Cal. Roll them in. Not too much, because I want to get a little bit on the lip. But okay, we'll roll the lip area. All right. And now, Kelly, do you feel a little burning? Mm-hmm. On a scale like 1 to 10, is it like level 1 or 2 or 3? Have a feel for how much it's burning?
It's only 2 or 3 right now.
And is your chest burning more than the forehead? Or which areas burn the most?
I'm burning right in here a little bit, but in the mouth.
So this is a very sensitive area too. Remember that all the blood flow comes into the mouth. 10% of the blood is coming right up to the head. And this area is the area that regenerates the quickest. And it has a very quick turnover of skin, so it's very sensitive to our peel. So around the mouth is an area where she would notice some burning. Notice she's still pretty red here on the chest, and it's a little bit irregular. She's nice and red here, but not enough over here. So I'm going to start touching up a little bit with our ProPeel number 1. So I put a little more in. And again, I squeeze it out over the trash can to make sure it's not too wet. And I'm going to go in and get some of the areas now that haven't reacted that much. So she's pretty red right here, so I don't need any more there. But not so red on this side over here. So we'll customize a little bit here. And we'll stay away from the redness on the chest, except in the areas that haven't turned red. Again, we're back on the forehead now, making sure that we've got everything cleaned up. Notice we're getting a lot less of the dead skin cells off now than we were before. And she has a nice reaction on the chest. Just got to catch up the old face. So roll your lips in again, Cal. That's it. I'm going to come across here a little bit. And we really want to focus on this cheek because it's not blanching as much as the other cheek. It's starting to get a little bit red right in the middle. The temple area is an area and along the ear that is resistant to the peel. So over here you can see too, it hasn't really turned red over here, especially in the temple area. An extra layer here. So now she has a nice red reaction on the neck area, enough there. And we want to stay away from the red reactions on the décolleté area. The neck is really good. The face is also starting to get a little bit red. Usually with the ProPeel number 1, it's mostly just a red reaction, sometimes burning. If they blanch a lot from the ProPeel 1, it means you probably go to ProPeel 2. And remember that if it's really sensitive, we'll skip ProPeel 3, but always use 4. So it could be 1, 2, and 4, or 1, 2, 3, and 4. Always include 4 if you're going to skip 3, so they get the advantage of the high-dose retinoid peel at the end to blend everything in. So at this point, roll your lips in one more time. She's good and clean here. We've gone over the eyes. And we're ready now to move on to ProPeel 2 and accelerate our program. She's had a nice reaction. We've got all the dead skin cells off. And we're ready now to, we've done 3 coats. And I don't count that closely. I mostly watch the skin. So it could have been 3 coats, 4 coats, 5 coats. But I'm looking for this reaction to tell me I'm at the right level. So now we're going to be able to move over to ProPeel 2. Remember that ProPeel 2 is our combined alpha hydroxy acid and trichloroacetic acid, the 2 together, along with some natural moisturizers like sodium PCA, sodium lactate, and urea. So the same idea, we're going to take our ProPeel and put up some on our folded up ruffle. Now here you see I'm getting a lot of fluid off. I put too much on my sponge, so I want to make sure I get any loose fluid off because I don't want it to run down her neck or to cause me any problems. So we'll make sure everything's out. Oh, there, see now it's good and dry. And we'll keep our dry one in the left hand. And again, we're going to start on the forehead to see how it's going to react. Now she'll notice the burning's going to increase a little bit. She's got like a burning 1, 2, or 3. With the ProPeel 2, she'll probably get a burning go up a little bit to like level 4 or 5. So tell us, Kelly, when you notice a little increase in the burning. Roll your lips in. All right, and then tell us what area. All right. Okay, now we're going to go to the décolleté area. Notice I'm still getting some dead skin cells off, so Usually halfway through number 2 or number 3 it'll be clean. We'll have stripped off all the old dead skin cells. So now we're going to start with our stronger solution in the décolleté area. Blend it in. You want to blend it in when there's no freckles. So see here the freckles kind of fade out, so we're going to blend in. So we fade out with the freckle area. She's got a little bit more on this side because, again, I'm right-handed, so I got to spend more time on the left to balance everything out. Feather it off here into the freckly area. Come up along the neck. And then, Kelly, what do you think? You pick up a little more burn?
Mm-hmm.
Any particular area?
Spreading down from the mouth, and then...
Still, your mouth is the area that's most sensitive?
Right, but I mean, it's moving down into the chin and then starting to spread, radiate out from the mouth.
All right. Forehead not too bad yet?
No.
All right. So we'll notice as she gets moving up on her index from 2 to 3 to 4 to 5 to 6, she's going to move the fan in closer. So she kind of gives us a signal. It's called fan anesthesia. So we can tell how they're reacting. Some people have that fan right on their nose right away. Other people don't feel very much. So it's an individual thing. But it's not worth giving anybody any Valium or anything like that, because if you get them drunk with Valium, they're harder to control than if they're just sober and working our way through it together. So she's got a little redness developing up on the forehead here. And she has like a birthmark right here, this red spot right here. So that's an area that will peel off, and because of that birthmark, maybe do a little electrolysis with the telangiectron. She has a spider angioma right here, so if you hit that little spider right here, hit the center of it, where the little arteriole comes up, you can knock it out. So we'll just touch it later on with our little coagulator. Take that out right there. That comes with the sun. Also comes, she's had a couple of children. If you get pregnant, more blood flow expands those vessels out. So now she's got her forehead going good. And we're over to the cheek area. And roll your lips in again. Going to do that area. The nose will always take more because it's really super oily. And then we've got our cheekbone. We want to focus on that. And then we're going to kind of take a look at our décolleté area. I doubt if her décolleté area is going to take very much of number 3 because it's already pretty red. But we're going to put some number 2 on. And then with our vitamin A at the end, we'll blend it all in and get a good peel. But you want to be careful with the décolleté area, especially the neck, because you don't have so many skin pores there to generate new skin cells. So let's say that we really get a good reaction up here on the forehead. There's 10,000 pores here that are ready to pump out new skin cells. And if you go a little deep, no problem, they'll help you out. They will regenerate new cells and heal it. Down here on the neck, you don't have those oil glands. You don't have the depth of the new skin cells. So here you got to be more careful. And that's the neck area, the most sensitive. Down here, there's still less pores than there are up on the forehead. So we can really push here, moderate here, be really, really careful in the neck area, and kind of watch the décolleté area. I don't know if you can see it, but right here we have all these fine lines from sun damage, and you can see them starting to develop. She probably sleeps on her side and developing these fine lines, so we're going to put extra right here to puff out these fine lines, which along with her skincare program will generate some new collagen. And if we can talk her not sleeping on her side, but sleeping on her back or on her chest, or maybe getting one of these striker beds where you roll around on a striker all night, you won't get these lines. We're going to work on them together. So how's our burning doing, Kelly?
It's an all-over sting right now.
So just arbitrarily on a 1 to 10, are you like a 5?
I'm creeping up to a 5, yes.
Ah, good. So we're going to put one more level of our number 2 on, only because she's not burning that bad. I want to put number 2 on, and then we'll go into number 3. This is our number 2, and I want to make sure again we're not too wet. Notice what I did was to fold the gauze over, so I didn't use a new gauze because this is all saturated now, and there's no use wasting the solution on wetting a new gauze. The old gauze is still fine. There's a new area. We'll put a little bit of the peel solution on, take advantage of the old coarse gauze, and do one more little scrub. We should not notice at this point many dead skin cells coming off, because it should be really clean. So we've cleaned her. We're starting to get a little penetration into the skin, and you can tell a penetration by the index of burning. All right. Now notice that she has more fine lines on this side. That's Americans have more fine lines on this side, so we're really going to be working on peeling those off. The British have more fine lines over here because they drive on this side of the road, and we drive on this side of the road, so more light comes in. But here's a good example of the light coming in from driving a car around on this side here. So extra peel over here, and roll our lips in again. All right. Then we're going to move down to our décolleté area, make sure we've got everything uniform. And the advantage of this peel is it's progressive step by step. So notice how I'm talking my way through it and taking my time, gradually developing a feel for her skin and getting a nice peel without going too deep. Back in the old days, we used 45% TCA. Then we went to 35 or 30% TCA. And by now she'd have a really red-white blanch, and we may have gone too deep. The advantage of this ProPeel is it's really going slow, and we keep an eye on the skin. Our chances of going too deep are difficult because it won't really go too deep with these levels. They're a safe level, the 7.5% and the 15% TCA. The nice thing about TCA is the more coats you put on, the deeper it goes. So we haven't got to use a real strong one. We just put more coats on. So that's what we're doing now, is putting more coats on. I'm starting to notice a little blanching. She has a little blanching here and around the follicle, where she has a little microcomedone. Wherever there's a comedone, the stratum corneum is not so organized, so you get a little blanching here. I noticed a little blanching over here on the cheek. So she had here's a nice little blanch right here. She had a really good reaction to the ProPeel 2, and we're now ready to advance to ProPeel 3. So burning is still about a 5, or maybe a 6.
We're creeping up to 6.
Aha! So you can see the blanching developing. Now with TCA, it's a slow blanch with these dilute solutions of 7.5% and later 15%. So you have to take your time and watch for the blanch. If we use a 45%, it blanches like a hot egg on a skillet. The problem is that once it blanches, you can't take it away. You've denatured the protein, and you can't reverse it. So it's much easier to do a slow-boiled, soft-cooked egg than a hot egg with a really, really strong acid solution. So now we're moved up to our ProPeel 3, which is our 15% TCA with more salicylic acid and our natural moisturizers like urea. So again, we squeeze some out. Want to get rid of any extra. And we again have our reserve sponge in the left hand. And now we're ready to go on to the forehead. So she should notice a little higher index burning with this level. Maybe it should go up to higher than a 6. Now we'll see how we do. And roll the lips in again. So we'll roll across the lips. I'm going to have her in every couple of days for a picture so I can show you her peeling as we go along. And then we'll go down to the décolleté area. And again, I want to make sure it's nice and uniform. But you can imagine, with all these coats I'm putting on, my chances of a nice uniform paint job are much better than if I had a real strong solution, only put one level on, I could end up with streaks. With this, you can't really get streaking because you've done so many times, it's always going to blend in. So we'll turn her over here a little bit, up along here, and check it out over here. So she's starting to move that fan a little bit closer. So what do you think, hon? Has it gone up to like a little higher? Let's go up to high. Put high on. All right, she put the fan up to high. Now what this fan does is to blow off the water and the alcohol, and to recrystallize the TCA to stop the peel. So she can control her own level of peeling by the fan. If we do the opposite, we stop the fan, it's going to burn a little more. And then the other thing is, if you put an ointment on at the end, the ointment will occlude the skin, occlude the TCA, resolubilize the TCA, and cause a deeper peel. So when we're finished, she just wants to leave it alone. Tonight, wash it off with the cleansing milk, and then start putting on tomorrow, after the cleansing milk again in the morning, her day treatment sunscreen and her marine cream conditioning lotion, one in the morning, one at night. But nothing today, because we don't want to activate the solutions again. So you can start to see she's getting some good blanching, and especially on the forehead here, you can see all these pores starting to blanch, and that's a good sign. So that means we're getting down, getting a blanch. Okay, let's roll lips in again. All right. And then we'll go over our décolleté area here. So now we're going to take our time a little bit and watch the peel develop. We want a nice little Obagi level 1, which is the foggy red blanch of a little bit of coagulated protein. Roll your lips in one more time. All right. And while we're letting it incubate, she can put the fan right up here. So this close fan. And we'll let it sit for a while and see how we end up with our blanch. You see how she's blanching in here. Each follicle is blanching. And she had some blanching over here on this side. She has also some blanching around the ear here, where she may have had a rash or something like that and had open skin. So over here also. And this area will take more of a peel. Starting to blanch over here, we have that blanch. So she's progressing along. We're doing like our soft-boiled egg. Notice how my solution and my gauze now is pretty clean. Very few dead skin cells coming off. We'll get ready for our next coat. So, Kelly, is it letting up a little bit or still pretty hot?
It's hot. It's like a 9.
Uh-huh. We moved up.
8.5, 9.
Yeah, we moved up from a 2 with our 1 to a 4, 3, 4 with our 2 to now our ProPeel 3, which is like a 7, 8, or 9. You can start to see, as we're letting it incubate, that more and more blanching is developed. We'll let this calm down, and then we'll end up putting on our vitamin A conditioning, which will give her the high level of retinoid peel. It's been a really good addition to our ProPeel program to add the vitamin A to it to make sure she has a uniform peel. And then we'll make sure you see her with our photographs every day or two until we have new skin. We're putting our cream to the cream coat on here. All right. Just roll your lips in one more time. We hit our décolleté area. A little extra in the middle to get rid of our lines. Then we'll blend it in. So I'm going to have her hold the fan really up close so she can drive off any of our solutions. And we'll examine then her blanch, which is all through here, and both cheekbones. And then we'll put on our vitamin A number 4. After that, she's going to look a little bit yellow, and we won't do anything then until like 4 or 5 hours from now. She takes a shower, showers it off, She doesn't need to do anything with the skin until tomorrow morning when she cleanses it with the cleansing milk and puts on her daytime and nighttime moisturizer. And then on the third day or third day when it begins to peel, she'll put an extra layer of the moisturizers on. And if it starts to peel off in big chunks, she can cut the peel with a scissor, but not to pull it. Because if she pulls it, over here is not ready, and she could get a little bit of a burn from her new sensitive skin. So, Kelly, you're still walking along about a 9?
No, I think we're at 10 now.
All the way to 10. So, notice it's blanching more. And if we bring the old fan right up here, we'll get this to blow off and see her final level of blanch before we put on the vitamin A. So I can see up here each one of her pores that had like a little micro-impaction and has a little disorder on top has turned white. That'll help peel those out, get rid of all the microcomedones. In her sunburn area here, it's quite red and blanched, which is just because that's the most sun-damaged area, the most open and porous area. All right. So we're ready now to put on the vitamin A. Now the vitamin A doesn't burn that much, but it has a high level of alcohol, so she may notice a little irritation from the fumes, but it's not nearly as bad on the burn as the number 3. So she's almost done. Now notice how yellow this sponge is. This is our vitamin A conditioning, the retinoid, which is, of course, vitamin A is like carrots, always red. So you can see how we're ready now to put this on. She'll look a little yellow when we get done. She'll just ignore that until she showers off at bedtime. So we'll put this on. All right, and remember I forgot to give it a squeeze, so we're going to squeeze any out. All right, get a dry sponge, so we'll go over this. Seems a little wet here. I want to make sure it doesn't roll into her eyes, so I'm going to use my extra one to blot off around the eyes. Then we'll go into the cheek area. Let's let this up a little bit for a minute for our camera, and we'll blend it in. This is really our blend coat. So make sure it's all blended in. Lower earlobe along the ear, up into the hairline. All right, and over here. Notice the nice blanching along here. It's the first time I've seen a nice blanch. She has the Obagi level 1 blanch right here. So if we do this, it looks kind of crinkly, and that's the epidermal slide of the Obagi level 1 peel in this area. And she's nice and blanched over here too. Let me not forget the décolleté, get that done. Want to make sure it's all blended in. And check out the forehead. All right, roll the lips in again. Do the nose, just gently over the eyes. All right. And make sure I've got everything covered. So now I've got her pretty well cooked with the yellow solution. Lift up here, huh? The high dose retin A peel, the end of our 1, 2, 3, 4 steps. So now she's all done. She's going to put that old fan right up here and cool off. So she did a good job, got through it. So the burning will let off in about 5 minutes. The burning will be gone. She'll still look a little yellow until she showers off tonight. And then she'll start to peel on the second day around the mouth area, onto the cheek area around the 4th day, and the hairline on the 5th or 6th day, and then we're done. She can gradually start in about 2 weeks back to her skincare program. If she was blotchy brown, we would start like at day 7 or 222 bleaching cream to make sure there's not any reactive hyperpigmentation, to make sure that she doesn't get blotchy brown. But in her case, Fitzpatrick type 1 skin, it doesn't know how to get blotchy brown anyhow, so we don't need to use that on her case. So Kelly, how do you think? Is letting up or still pretty hot?
No, it's letting up.
Usually it's over in about 5 minutes. If she stops the fan, it'll pick up and burn a little more. So you kind of tell them, to use the fan or let up. But she's still using the fan. All right. So she's all set. I make sure I close my solutions up. Usually each one of these is good for 2 or 3 ProPeels. So in this case we used about half, and we got enough for our next case. And then of course the more they condition, the better the peel. And in her case, we'll peel it off, gradually get back to her skincare program in 2 weeks, do a repeat ProPeel in 30 days if we need to, but probably figure on like 4 peels during the next year. What do you think? Still burning?
That's still burning. Are we done?
We're done.
Off camera?
We're done.
Oh, I can't take the fan away.
Nah, still likes the fan.
I just gotta hold on to the fan for like a little while.
All right, we'll let her sit and relax.
5 minutes.
Yeah, they control their own fan, so she might stay on the fan for 5 minutes, 10 minutes, maybe for a lifetime. Ha! Good job. This is our patient before the peel. You can see her sun damage from spending too much time at the beach. This is right after the ProPeel. You can see the yellow U from ProPeel number 4, the vitamin A propionate. This is her peeling, beginning at the center of the face in 3 days. Then it'll progress on to the mid-cheek. Here we are at 6 days with some peeling left on the nose and the forehead. Here she is with all the peeling gone, and you can see a freshened complexion. This is after 20 days. Notice that it's much lighter. It looks like she didn't beat up her skin at the beach.